Hello everyone. Today we are going to discuss MCQs on the topic of droplet precautions. These questions are designed to assess understanding of key principles, PPE use, disease requiring droplet precautions, and appropriate room placement. This information can be used for education and staff training. Question number 1. Which of the following is a key characteristics of pathogens that require droplet precautions? A. They are transmitted via airborne particles less than 5 microns in size. B. They require contact with contaminated surfaces to spread. C. They spread through large respiratory droplets more than 5 microns during coughing or sneezing. And D. They only spread through blood or body fluids. We are going to wait for a few seconds for the correct answer. And the answer is C. The characteristics of the droplet precautions of the pathogens of the droplet precautions is that they spread through the large respiratory droplets more than 5 microns during coughing or sneezing. Question number 2. Which of the following diseases require droplet precautions? A. Tuberculosis, B. Measles, C. Influenza, and D. Scabies. And the answer is C. Influenza requires droplet precautions. Question number 3. What is the minimum recommended personal protective equipment for entering a room of a patient on droplet precautions? A. Gloves and gown only, B. N95 respirator only, C. Surgical mask and eye protection, and D. Face shield only. And the answer is C. The minimum recommended PPE for entering a room of patient on droplet precaution is surgical mask and eye protection. Question number 4. When should a healthcare worker don a surgical mask when caring for a patient on droplet precautions? A. Only if performing an invasive procedure. B. Only if the patient is coughing. C. Upon entry to the patient's room. And D. Only if the patient is not wearing a mask. And the answer is C. Upon entry to the patient's room, a healthcare worker should don a surgical mask when caring for a patient. Question number 5. A patient on droplet precautions must be transported through the hospital. What is the appropriate action to minimize transmission risk? A. Have the patient wear an N95 respirator. B. Disinfect the transport vehicle after every use. C. Have the patient wear a surgical mask during transport. And D. No special precautions are needed for transport. And the answer is C. Have the patient wear a surgical mask during a transport. Question number 6. What type of room replacement is appropriate for a patient on droplet precautions? A. Negative pressure isolation room only. B. Private room or cohort with another patient with the same infection. C. Open way with other patients. And D. Any room with HEPA filter. And the answer is private room or cohort with another patient with the same infection. Question number 7. Droplet precautions are typically required for which of the following bacterial infections? A. MRSA, B. C. diff, C. Neisseria meningitidis, and D. Mycobacterium tuberculosis. And the answer is C. Droplet precautions are typically required for Neisseria meningitidis. Question number 8. Eye protection, goggles or face shield is recommended for droplet precautions because A. The droplets can only enter through the eyes. B. Eye protection replaces the need for a mask. C. large droplets may contact mucous membranes of the eyes. And D, pathogens can be transmitted through eyelashes. And the answer is C, large droplets may contact mucous membranes of the eyes. That's why eye protection is needed. Question number 9. How long can large respiratory droplets remain suspended in the air? A, several hours. B, less than a minute. C, up to 10 minutes. And D, they remain airborne indefinitely. And the answer is less than a minute. Droplets usually fall to the ground within about 1 meter. Question number 10. When exiting a room with droplet precaution, what is the correct sequence for removing PPE? A, gloves, gown, hand hygiene, mask, eye protection. B, mask, gloves, eye protection, and then gown. C, gloves, gown, hand hygiene, eye protection, mask, and hand hygiene. And D, eye protection, gown, gloves, and mask. And the answer is C. The correct sequence of removing PPE is gloves, then gown, then performing hand hygiene before reaching to the eye protection, then mask, and then hand hygiene at the end. That's all for today. Thank you for joining me.